This is Gotomo. A predominantly rice farmers' village in Kebbi State, northwestern Nigeria. In Ikora Ekiti State, southwestern Nigeria, the women make gari from processed cassava, while the men engage in farming. Agbani village in Enugu State, southeastern Nigeria. According to data from the World Bank, 54% of Nigerians live in communities like this. The inhabitants are predominantly subsistence farmers with fewer resources, little basic infrastructure, less education, poor transport system. They are also mostly vulnerable women and children. The rural communities are usually far away from the closest medical facility, and due to the prevailing economic condition, most of the people in these rural communities are underserved. It is a different story in Oke Areba community in Abeokuta South local government in Ogun State. A rural community of about 23,000 inhabitants, though this community has just one health facility. The community, along with its neighbors, are serviced by a state-of-the-art mobile health clinic provided by the MTN Foundation. On typical medical outreach days, people wait for the clinic to open. The MTNF Yellow Doctor Mobile Medical Intervention Scheme, also known as the MTNF Yellow Doctor Project, is delivered in partnership with the National Primary Healthcare Development Agency, NPHCDA, and Center for Integrated Health Program and the beneficiary state's Ministry of Health to further enhance the efforts of the federal and state governments towards improving healthcare delivery in Nigeria, especially in the rural areas. The project was launched with a public presentation of the mobile clinic trucks to the media in Lagos.
Just to tell you a brief story about the Yellow Doctor Project. This project involves the deployment of 6 state-of-the-art mobile clinics with consumables and drugs for 1 year. We had expressions of interest in the newspapers, which we sent out, inviting various state ministries of health to apply. We had numerous applications. We shortlisted the applications and then followed that with verification visits across a few states. And then we came down to 4 states out of the first set of applications.
I cut state to formally launch the MTN Yellow Doctor Scheme to the glory of God.
These are actually the temperature regulators. So what we do is that for each of the rooms, they have the separate temperature regulators. So if the patients are very cold, you can actually change the temperature. It is both the weighing scale and the height meter. So you actually would unfold it all the way up so that you can take the height and the weight of the person.
This is a very good first for both the MTN Foundation and the National Primary Healthcare Development Agency, working as a public-private partnership. This is the way we think government should work with the private sector. That's both of them hand-holding each other and providing the necessary support.
To ensure smooth delivery of operation, project personnel from all the beneficiary states were trained.
This is your lab. That's why you have this. This to keep whatever sample. I think some of them in the fridge. I don't know where to put them in the fridge. Yes, for the lab. This way is that lovely toilet I was telling you about.
Those trained include a state focal person, a state project coordinator, and a driver for the mobile medical truck. After the formal launching, the trucks were thereafter taken to the beneficiary states of Ogun, Delta, Abia, and Taraba, with 2 remaining states representing the northwest and north central regions to be announced later. The MTNF Yellow Doctor project was well received across all the beneficiary states.
You know that we cannot get hospitals to everywhere, and government cannot do everything. So you need to work with the private sector. And MPN being a private sector, they are partnering with us.
In fact, we want to extend even the agreement, over and above a year. And we also intend to procure more so that at least each zone should have one of this. This is very interesting, and we are proud of MTN.
It does. Because I mean, those places that we recognize are underserved, but that we need to get to, we can take this kind of mobile clinic there and do outreaches there until the government has managed to get around to building a substantive primary health center in those places.
Now, for the casual observer, the mobile clinics are mere trucks. This is the interior of the MTNF mobile clinic. Each MTNF Yellow mobile clinic is stocked with drugs and consumables, and is also provided with financial requirement for the project for a period of 1 year. A typical MTNF Yellow mobile clinic medical team comprises of a doctor, a nurse, a pharmacy technician, a driver.
It's like a one-stop shop that will go into these communities to help look at pregnant women, to help look at children, especially children under 5. It will help to improve the immunization status of children. It will look at the killer diseases among children.
Health is wealth. So goes the maxim. And that's what MTNF Yellow Doctor project is bringing to communities across Nigeria. Okay, Aregba is one of those communities across Nigeria enjoying this novel initiative from the MTN Foundation, the corporate social responsibility arm of MTN Nigeria.
I would say a big thank you to MTN, because most of us, because of the bill outside there, could not be able to afford going for checkup. But by His grace, now with this, at least you can see many people are here to do the necessary thing.
If every organization, private organizations, partners with government to provide some form of service, it will make the work really easy, because really government cannot do all.
The MTN Foundation Yellow Doctor Mobile Medical Intervention Scheme is one of the means through which MTN Foundation CSR activities contribute to the efforts of the federal and state ministries of health to improve overall health care delivery in Nigeria.